Dr. Tina Yang is a fourth generation Chinese medicine doctor, licensed acupuncturist, and herbalist. She's a fellow of the American Board of Oriental Reproductive Medicine and a certified Reiki master. And she is truly a wealth of knowledge when it comes to the traditional Chinese medicine approach to fertility and women's reproductive health. She was such an instrumental part of my own personal fertility journey and has just been a dear friend ever since I started working with her many, many years ago now. And so we have such a wonderful conversation here. And I really think it's going to be so helpful to anyone who's really looking for a different perspective on their reproductive health, whether they're dealing with hormonal issues, they're trying to get pregnant, maybe they're struggling with getting pregnant. She really goes into what acupuncture really is and what traditional medicine really is. And it goes so far beyond just getting poked by needles. So, especially if that has been something that's been a barrier to you for exploring this avenue, this is really a great conversation to dive into. And I think you're going to really enjoy it as much as I did. Dr. Tina Yang, thank you so much for being with me today. I'm so excited to talk with you.
Thank you for having me, Dr. Naylor. It's such an honor and a pleasure to be on your podcast. So I really appreciate you taking the time to chat with me.
Yeah, thank you. Now, I want to share with the listener how we first met because you are near and dear to my heart, of course, because when
Oh,
I was started my fertility journey, even, I mean, before it really was a fertility journey, when I was just trying to get my period back, you were there and you were the one who I found because I think I probably heard somewhere that acupuncture and traditional Chinese medicine can help with reproductive issues. And I was sort of at a loss. And I found you. Your office was like 2 blocks away from my house at that point.
I
And I found
remember. It was
you,
like,
and we created this relationship. And I ended up working at the office with you and everything. And it just really, I mean, I think you've had such a positive impact on my life personally and professionally. So I have so much gratitude towards you. And again, I'm
oh,
really excited to just
thank you.
pick your
Well,
brains
the
then.
feeling is mutual,
Yeah.
Dr. Naylor. I know that when you moved down to San Diego, it was definitely the right move for your family. But I do have to say that there's not a time where we don't all miss you.
No.
So, of course, you're very near and dear to my heart too. And I'm just, so happy for you and your family and your two beautiful boys. And
Hmm.
to even be part of that journey was, just incredible.
Yeah.
So, thank you.
Yeah, of course. So, well, let's jump into things. So, you are highly specialized in, reproductive health from a traditional Chinese medicine and acupuncture standpoint. And I'd love to hear, maybe we start with, maybe explaining what you do or what the approach is that you take and how especially it can be helpful with reproductive health and fertility.
Sure. Well, I'm a Chinese medicine doctor and acupuncturist, and I've been practicing for over 20 years. And, when you start off in training, acupuncture and Chinese medicine is kind of like internal medicine, right? You treat a lot of different things. And our training is heavily pain management based. So a lot of the experience that you get in school and in internship and in clinic is really around treating pain conditions or conditions related to the nervous system. So maybe like Bell's palsy, stroke patients, low back pain. That's very, very commonly treated when you're in, that's what you treat when you're in school, which was an incredible experience. And a little bit of women's health, but not as much when you're in school. And I think when I was going through my training, I was always really interested in women's health. And soon after I finished my training, took the boards, got licensed, I got married, got pregnant. Everything happened really fast, and as life is. And so I had my first son, and I just knew after having my first son that I was meant to help other women through the process of pregnancy, postpartum, and also fertility, just becoming a mom. I just felt like everybody needs that support. And, 22 years ago, I don't think we had the resources that we have now, especially with pregnancy support and postpartum. I felt like the care that I was given was very subpar. And so it really helped me hone in my practice to specialize in treating women in these like vulnerable phases of life and to really optimize your health and your well-being so that you can thrive during these times. So that's kind of how I started in women's health, and I really quickly got like obsessed with fertility. I'm going to say it's like my practice, passion, and obsession is to help couples, grow and start and grow their family, essentially. And I think, once you become a mom, you're like, everybody needs to experience motherhood. And so
Mhm.
that's kind of how it started, specifically for fertility.
Mhm. Awesome.
So, in terms of what we offer in our practice, we offer, of course, acupuncture and all the modalities within acupuncture. So, that can include things like moxibustion therapy, which is a Chinese herb that we use to kind of warm the body, warm the womb. We use that quite a bit in fertility. And it's also really popular for breech pregnancies. So,
Mm.
that's used quite a bit to help to turn babies cephalic if a woman is, diagnosed with a baby that's either transverse or, face the baby's feet first. So,
Mhm.
so a lot of times moxibustion is well known for that, and we also provide cupping therapy and some of the other modalities like TCM diet and nutrition, as well as Chinese herbal medicine, which is a big part of our practice as well.
Mhm. Awesome. And I think, from my viewpoint, especially when it comes to women's health and like you said, the journey to motherhood, the conventional approach is very lacking in giving a lot of support, especially if you're needing more support than, like if everything's working great, then fine. But when people maybe aren't feeling the best or having an issue with getting pregnant, there's so little that can be done. And so I feel like in my mind, this is one place where traditional Chinese medicine acupuncture really shines
Hmm.
because it does give so much more, different modalities that are safe and approachable and also can do so much more than again the traditional
Absolutely,
approach.
for
Um,
sure. Yeah, and I think for women, it kind of creates a safe space too. And,
mhm,
during our sessions, I feel like there's an opportunity to, there's always a check-in point and there's an opportunity to kind of touch base and see how patients are feeling. And we really focus on the mind, body, and spirit of the patient. Even though it's a physical medicine,
mhm,
there's an aspect of Chinese medicine that's very emotional and spiritual based. And when you're going through the journey of becoming a mom, it's tough. I really think it's easy to kind of jump on that fertility train. I call it the fertility bullet train, where you're like, okay, I'm on
mm,
this train and I just got to keep going. I can't get off. I need to, get monitored, get my labs done, try Clomid, do an IUI. If that doesn't work like 2 or 3 times, then I have to jump into IVF. And I think
mhm,
some women are afraid to pause and get off the
yeah,
train for a moment, and they
mhm,
just feel like they need to keep going. And so that's where I feel like Chinese medicine and acupuncture can really help patients be in the present moment and slow down and pause for a second and reflect. Like,
mhm,
is this really the best thing for me to do to jump into another IVF cycle? It's okay to take a break. And
mhm,
because I'm still doing something, I'm still with Chinese medicine and acupuncture, we're still working on your hormone balancing, your stress levels, we're nourishing your body, we're helping with egg quality. So patients can feel like they're still moving forward without like that bullet train, speed of like, oh my gosh, I'm so scared to get off. So it's
mhm.
like a slower train, you know? So,
Yep. That's
hmm
such a good description because it really is like that, especially once someone starts working with a fertility clinic. It can feel like,
hmm
okay, this is the next step, this is the next step, this is the next step. And it goes
right.
very quickly to IVF. And people are like, wait, I talk with so many couples who are like, they do feel like they're jumping the train and they're like, I don't know what to do. Time is passing me by so quickly,
Yes,
this like pressure of if you wait, even a second, all of a sudden your chance is going to be gone. Uh,
totally.
so that's
And,
so
and it
great
makes
that
me
you
so
can.
sad for those patients because
Yeah.
I just, that pressure that they're already putting on themselves, and then there's that added pressure of treatment.
Mhm.
And, I always tell patients like 1 or 2 months is not going to make a big difference in the grand scheme of things if you're taking a break from ART treatments. Like let's nourish you and take care of you so you'll have an optimal cycle, and you'll get better follicles, better eggs, and better embryos if IVF is what they're doing.
Yeah.
So,
Yeah, I completely agree. And it's actually better, in my opinion, to take that route because, yeah, if they are just doing the same thing over and over and over again, expecting a different outcome, it's like that's the
mhm.
definition of insanity, right? Where,
Exactly,
yeah,
exactly.
maybe if it didn't work the first time, maybe you should step back and actually taking the time to change something would actually be
Hmm. Yeah, what
helpful.
are you going to do different this cycle
Yeah,
to
exactly.
change the outcomes and Yeah, and sometimes it's even about maybe you get a second opinion. Maybe the
Mhm.
reproductive endocrinology clinic that you're with, you've already done a few cycles and they haven't been favorable, and it's okay to get a second opinion.
Mhm.
And to be honest, if they're taking a break from treatment, there's a part of me that's always secretively hoping that they'll get pregnant naturally in
Mhm.
between.
Yep.
And
Yep.
it happens actually more often than not.
Yes. It does
So,
happen a lot. Although then that's that added pressure, right? You like don't want to tell people that because then, and some people know, they're like, I know that it could happen, but I also don't want to pressure myself into thinking that that will happen.
yes.
It becomes
Yes.
such a mind game. So
That's
it's
right. That's right. We call them bonus babies.
I love that. So I would love to hear, maybe without explaining all of traditional Chinese medicine,
Hmm.
but how specifically, like through your viewpoint, how are you looking at the body and reproductive health and fertility to change that environment and improve those things that we were just talking about?
Yeah, that's a really good question. I think it depends. Most patients that come to see us kind of have a Western diagnosis already.
Hmm.
Whether it's PCOS, endometriosis, or diminished ovarian reserve. So we definitely keep that in mind, and I feel like integration is really the best approach these days. However, in Chinese medicine, we still look at a pattern diagnosis, and that helps us determine our treatment plan in terms of the type of acupuncture treatments we provide, maybe the herbs that we provide, and even dietary recommendations. So, to give you an example, stress, which is pretty prevalent in most people, fertility patients or not, that is usually correlated with the TCM diagnosis of liver qi stagnation. So the liver in Chinese medicine is considered the general that is like in charge of your qi or your energy.
Hmm.
And so it makes sure that things are flowing freely and that things are getting done and you're productive, but the liver gets out of balance very easily. So
Hmm.
because of that, our chi can stagnate, or our life force or energy that circulates through channels and meridians, kind of like a freeway network. So we describe these meridians that way, and they are in an ideal situation when things are flowing freely, they're like a highway with no traffic jams and
Hmm.
no car accidents. And so that allows chi, blood, and nutrients to flow to your tissues, to your organ systems, to nourish your body and to help keep your body in a state of homeostasis and balance. Unfortunately, in real life situations, we have stress, we have, dietary things, maybe we make poor choices in our lifestyle, and eventually our chi will stagnate. And with chi stagnation comes blood stagnation, which can create blood stagnation not only in different muscle areas, which can cause pain and tension in our body, but that chi and blood stagnation can also affect your uterus and your reproductive system. So when that happens, we'll see things like painful menstruation or irregular menstrual cycles, um, clots and cramping during your cycle, things like that are
Hmm.
very common that we'll see. So our job as acupuncturists is to help remove some of these blocks and the stagnation that's occurring in our body so that
Hmm.
everything can flow freely again. So commonly when patients come in for treatment and if they do experience dysmenorrhea from time to time, one of the first things they'll say is, "Wow, my period was so much better this time. It was
Hmm.
bright red in color, it flowed better. I didn't have to take Advil." So that's a common result of getting treatment.
Awesome.
So
Yeah.
I'm not sure if
And
I answered that. That's just one
you
example.
did. Yeah, yeah, you did. Because I know it's probably hard to explain it in like a Western viewpoint because it isn't in the same arena, really. It's really
Yes,
looking at the body from more of an energetic standpoint. When
right,
people
right.
hear, like, especially I think, again, my brain, when I first heard about acupuncture, I was like, wait, liver, kidneys, what are you talking about? These are
Yeah,
like physical
you think
organs.
about
And like,
Western organs, right?
right, yeah, yeah,
Mhm.
yeah. And
Yes,
so it is completely different, but I love the approach to it in that you're really looking at the life force of our body and how our body works best. And I think even though I look at things from a more Western standpoint, I do the same thing in my mind of what is getting in the way of your body working optimally. I'm
right,
looking at maybe
right.
from a different viewpoint, but it's still the same thing. Like what's getting in the way rather than just okay, here's what's wrong with you. Let's do something about that thing that's wrong. It's like, no, let's get rid of that thing
Yeah, for
and
sure.
just
And I think Chinese medicine is really interesting because although there's that sort of more ancient model and description of the way it works, when you tie it back into Western medicine, it's kind of cool. Like when I think about the HPO axis,
hmm
and I think about like, okay, if a patient has amenorrhea or hypothalamic amenorrhea, it's because there's that disconnect in that HPO axis. And so because acupuncture is so good at stimulating the central nervous system and the peripheral nervous system to, to produce the hormones and the neurochemicals that are necessary for the body to function properly. I've seen so many amazing things happen with patients that are not cycling or patients that, haven't had a period since they got off of birth control and it's been like a year. I mean,
hmm
it still amazes me how well it works on stimulating and reconnecting and balancing the HPO axis.
Yeah.
So yeah, it's fascinating to be able to kind of explain it in a Western medical standpoint and then a TCM standpoint and really bridging like the two medicines together to
hmm
support our patients.
Yeah. Yeah. I love it. And I do one of the things that really like lit up in my brain when I heard it as described to you. I believe it's a book called Energy Medicine. I don't want to misquote it, but she talks about the meridians and how they line up with the energetic. I don't know if they were called nodules or something, but like when
Hmm.
we're in
Right.
utero, when the fetus is even developing, there's like no blueprint or instructions, but there are these energy nodes that that it I don't know, things develop along, or those cells that are developing go
That's,
along, and it lines up with the meridians. And I was like, oh
yeah,
my God, mind blown. That is
right,
because
right,
I think also in the Western approach, we kind of think we have it all figured out. We see things, we examine things, and then we're like, this is reality. But there is the energetic standpoint that we don't fully see or understand. And I think that's where traditional Chinese medicine really
right.
is
And
that
to
more.
your point about the meridians, there's actually a meridian called the conception vessel or the
Hmm.
Ren meridian. So it's obviously highly used when patients are
hmm
trying to get pregnant. But, traditionally, I think when you think about thousands of years ago when there wasn't all the technology and the labs and the ultrasounds and the things that we have now to
hmm
see the state of our fertility, I think working on things like the conception vessel, it's connected to the uterus and, the Chong meridian, which is the sea of blood, like really tapping
hmm
into those channels and meridians can balance a woman's cycle out and hence make them, more regular and more fertile. So I love that you have read that book because it's so true. And, I think about all our forefathers and, the previous Chinese medicine doctors, how wise they were to
hmm
think of these things and to select certain acupuncture points that actually increase blood flow to the uterine artery
Yeah.
and being able to utilize those points to help with uterine receptivity, to help with follicular development and quality. And I'm still amazed by the medicine all the time.
Yeah. It
So,
really is so incredible. You're right that they, like you said, without the technology, we're able to figure out so many things and work with the body instead of
hmm
against it to make these
hmm
things happen. So cool. Well, with talking about this, I mean, I guess maybe on the line along the lines of fertility, what are the things in particular that you do? I mean, you kind of covered it, herbs and diet and things like that, but maybe someone who is coming to you who is having a harder time getting pregnant, maybe what are some things that you're looking at or doing with that person or couple?
Yes, I think, if they're working already with an REI, we definitely collaborate with a lot of fertility specialists. I'd say I feel like I've probably worked with every fertility clinic in Orange County. And,
hmm
we kind of assess where the patient's at and meet them where they're at. So if they're in the middle of an IUI cycle, we'll certainly do acupuncture, lifestyle counseling, review their supplements, and sort of fine tune what they're doing with their diet and lifestyle and nutrients. If there's somebody that's maybe trying naturally or they're taking a break, that's when I feel like we have a little more range and freedom to do other things within Chinese medicine. So I usually will take the opportunity to prescribe Chinese herbs anytime I can. Even if they're like, I'm taking 2 months off before my next IVF, then
Mhm.
we will usually customize Chinese herbs for them depending on what's going on. So if a patient, for example, has like diminished ovarian reserve, we would really focus on Chinese herbs that can help with egg quality, that can tonify what we call like the kidney essence, the kidney yin and liver blood of the patient. And of course, we always include stress reduction hormones because who is not stressed when you're trying to conceive? And I think when you're going through IVF, it is like a part-time job. It's like another job. It's a lot. And so we always focus on stress reduction, reducing cortisol levels, whether it's through acupuncture or some of the other nutrients that can help. And I think functional medicine is such a great complement to all of this to be able to assess the adrenal status of a patient too, and just knowing like the whole pregnenolone steal and how, our body's always going to prioritize our stress hormones over everything else, over our thyroid, over our reproductive system. So really being able to get patients into that state of relaxation and surrender is key. So I'd
Mhm.
say, one of the differentiating factors I think for our practice is really focusing on that aspect for women and just saying, hey, let's really downregulate your nervous system. What can we do between treatments? What can you do at home to reduce your stress, whether it's meditate or practice yoga, even if it's like 10 minutes of yoga in the morning to set the tone for the rest of your day.
Mhm.
And, even things like setting boundaries at work and personally,
Mhm.
simplifying your life for sure.
Yes. So
So,
important rather than
mhm.
doing more, right? We tend to think, oh, I have to do more. I have to do something different. I'm not
Yeah,
perfect enough on something. I have to do better. And you're right. A lot of the time we have to do less or really focus on, nourishing
ourselves. Well,
ourselves.
a good friend of mine said it best, a
Mhm.
fertility specialist or coach that I work with. She said,
Mhm.
mothering the mother to be. Like, really, we need to take care of ourselves and nurture and mother ourselves before we become moms.
Mhm. Yeah.
Because,
You have
boy,
no
after we
recovery.
become moms, there's not a lot of time for that. So,
Right? Yeah, it just end when you get pregnant. You then have to
right.
like sustain yourself during pregnancy, feeling your best,
Mhm.
and then yeah, you need something in your tank to be able to show up as a mom. Yeah.
That's right.
Awesome.
Absolutely.
Well, I love that you mentioned the herbs, and I'd love to learn more about that maybe. If there are certain herbs that you really utilize the most or ones that you love for certain reasons.
Yes. Well, so one of the formulas that I created called Fertile Womb is based on a classic formula that has Dangui or Angelica, which a lot of people are familiar with. By Shao is peony. And both of these herbs are considered chief herbs in the formula. They are considered blood tonics. And
Mm,
so the blood tonic category in Chinese medicine nourishes and tonifies the blood while gently moving blood. So Dangui is actually known to kind of help with period pain and cramping and things like that. So that those two herbs are the chief herbs in fertile womb, which are very
mm,
helpful. And then there's other herbs within fertile womb that also help to reduce stress, like I was mentioning, and
mm,
kind of calm the spirit or calm the mind is what we say. And there is a category of herbs called kidney jing or kidney essence herbs.
mm,
Those usually are animal byproducts. So,
mm,
like, you'll hear about Lu Rong or like deer antler, for example. Those are highly used for both men and women in fertility.
mm,
So that is another formula or another herb in the formula. But generally for our patients, if they're not taking like a preset formula that we've created, we like to custom blend tinctures, which are liquid tonics. And those can be really potent because if anybody has GI issues or they have a hard time absorbing supplements that they're taking, like through a capsule or a tablet, I feel like tinctures are a really good option for those patients. And we use a line of herbs called conceivables, excellent
mm,
line of herbs. But what we can do is modulate those formulas according to the phase of their cycle. So
mm,
if a patient is really wanting to work on egg quality, we would definitely kind of boost up the herbs in the follicular phase. If they have problems with ovulation, then we might create a formula specifically to promote ovulation. If they have PCOS, for example, there's herbs that can help with that too. And if they have a luteal phase defect, then we would emphasize the luteal phase, or what we call like the phase two formula. And so
Mhm.
we really custom tailor it for the patients and what their constitution is like, what's their hormonal status, accordingly. So
Yeah.
I wish I
That's
could say there was like one size fits all, but it's definitely not that way
right.
in Chinese
Yeah. Well,
medicine.
honestly, I mean, I've in my mind, that's even better, right? That you're making sure that it is tailored because it makes me a little bit nervous. And wanted to ask you, like, some of those herbs you mentioned, dong quai, like, and forgive me if I'm not saying it correctly, but you see it in a lot of
You're
formulas, like these
perfect.
like generic PMS formulas and things like
Hmm.
that. And sometimes it makes me
Hmm.
wonder, could someone be doing something that's inappropriate for them? Could they possibly cause any harm with things like that if it isn't customized to them or really the appropriate thing?
Yeah,
Or
I
do you
think
see
with
that?
Chinese herbs, you have to be kind of careful because even though they're not, specifically estrogen or specifically progesterone, they do have estrogenic and progesterogenic effects. That's why they work so well in
Mhm.
regulating a cycle or helping with the luteal phase and elongating the luteal phase if a
Mhm.
patient has progesterone deficiency. So, but if a patient is estrogen dominant, you want to be careful because there are
Mhm.
certain herbs that can kind of contribute to the estrogenic effects of everything. So it is really important, I think, when you're dabbling with herbs to probably consult somebody that can kind of help you
Mhm.
decipher what would be appropriate for your constitution, your body type, and your hormonal status,
Mhm.
for sure.
Yeah, great.
But
Um,
a lot of these over-the-counter supplements, to be honest, Dr. Naylor, they're usually low dose, so I think they're pretty benign for the most part.
yeah, that too. There was one gummy in particular that's just coming to my mind that was like again like a PMS gummy. People were asking
Hmm.
about it, and I was like, well, it probably won't do any harm, but it probably won't do much benefit either.
Especially in a gummy
It's
form.
also going to be tasting good,
Yeah,
so who
exactly.
knows?
Hmm.
Yeah, well, that's really helpful. And on that note too, again, you've kind of described all these different modalities that you can help people with, for the person who maybe is terrified of the thought of getting poked by needles and is,
Hmm.
maybe like avoiding all of traditional Chinese medicine because of acupuncture, you know, it sounds like you have things that you can do to still support them.
Definitely. We have options, and I have treated a handful of patients that are needle sensitive or, have kind of a fear of needles. So we can certainly do acupressure instead. Essential oil acupressure is really popular, where we apply essential oils to the acupuncture points instead of needles, and they can have such a calming effect. So, for example, like the third eye here or yin tong, we might apply something like lavender, which kind of corresponds to the acupuncture point of calming the mind, calming the nervous system, helping with sleep, stress, and anxiety. So we kind of pair the oils with the function of the acupuncture points. And so it's kind of like when I treat children. I usually
Mhm.
start with acupressure first or essential oils until they feel more comfortable and they begin to trust us a little bit more. And so hopefully, eventually, they'll be willing to try a little bit of acupuncture. So there's that option. And of course, there's moxibustion, which is the therapy that I mentioned earlier. Moxibustion is made from an herb called Artemisiae or Ayaye or mugwort. Those are the common names for it. And we can use the moxibustion over the acupuncture points instead of needles.
Mhm.
So we get very close to the point. We don't actually burn the skin. We get close to kind of warm the point, and then we kind of retract the moxibustion if we're using a moxibustion stick form.
Mhm.
So that's also a really good option for
Yeah,
patients. Hmm.
cool. And I know that sometimes you also use like an electrical current to increase the
Yes.
potency of treatments and how, I mean, maybe if you can explain sort of that, kind of when you use that and what that can do.
Definitely. So electroacupuncture is a modality within our scope that we use quite a bit for pain management and for fertility. So when we're using it for fertility, traditionally, once a needle is placed in you, an acupuncturist would go through each point and stimulate it by hand. And they'll do that several times throughout your treatment. So let's say you have, a 30-minute rest time in your treatment. They might come in, once or twice to stimulate those points and then stimulate them one more time before they take the needles out. And so what that does is it helps to promote more chi and blood flow and movement. But in modern times, there have been these machines or devices that have been created to simulate the manual stimulation of the needle. So, if you're familiar with a TENS unit, which is what a lot of chiropractors and physical therapists use, it's similar to that, except instead of using electrode pads that are placed on the muscle, we actually have electrode leads with clips at the end of them that connect to the needles. And so once these leads are clipped to the needles, it helps to vibrate and stimulate the needle at a certain rate, frequency, and strength. So depending on, what we're trying to do. But in general, electroacupuncture has been shown, there's actually been studies and research that have shown that acupuncture with electrostimulation helps to increase blood flow to the uterine artery and it increases the blood perfusion rate.
So,
So lots of studies around that. In fact, there's a lot of IVF protocols that have been designed around that particular study,
mm,
and how it can, just encourage more blood flow to the ovaries as well as to the uterus.
yeah, which is so important. I think we take it for granted, like how important blood flow and just flow of those nutrients, like you mentioned, to our reproductive organs. It can really just be cut off with chronic stress. So
Absolutely.
important.
Definitely.
And I'd love to hear a little bit about, I know acupuncture can be such an important role while doing IVF. Where, how do you time that? What is the role while doing IVF cycles?
That is a fantastic question. We get that a lot. So, again, depending on where you're at in your cycle, if it was an ideal scenario for me, I would love to see patients like 2 to 3 months, sort of in that preconception care window,
Mhm.
prior to starting IVF. But unfortunately, we don't always get that opportunity. So sometimes patients are already in cycle. But if we do have a month before they start a retrieval or stimulation cycle, that is ideal. Because as we know, the oocyte cycle is 120 to 150 days. If a man's coming in, their partner's coming in, 90 days for the sperm. So if we can work on that prior to starting a cycle, I would love that. I always joke with men like, "Hey, wouldn't you like a genetically superior child?" And their eyes just get really big and they're like,
Ooh.
"Yes. What do I need to do? How many treatments do I need to come in for? And what supplements do I need to take?"
Yeah.
But as far as IVF patients that are already in cycle, we generally will see patients at least once or twice a week during the stem phase,
Mhm.
to kind of help optimize the blood flow to the ovaries so that, hopefully it will help to affect follicular development and egg quality. And then generally, patients will take a little bit of a break after retrieval. Well, number one, if they're getting genetic testing done, there's a wait period before you find out the status of your embryos. And we usually continue to treat in that time too. And if they are going through some additional testing, common things would be like ERA testing or endometrial receptivity assays. They potentially might be doing like a hysteroscopy, some other clinical tests that need to be done prior to transfer. We usually continue to see patients through that. And then when they're preparing for their frozen embryo transfer, it's all about uterine receptivity and lining support. So we, again, will treat patients once or twice a week, for that duration until transfer. And then on the day of transfer, the Paulus study, which is very popular, that was released in 2002, was like such a significant study on acupuncture and IVF support. And that was a study that was just done 25 minutes before and after embryo transfer.
Mhm.
And the clinical pregnancy rate for the acupuncture group was like over 46% versus
Wow.
the non-acupuncture group was like 26%. So that was the article, or that study was the one that kind of made all the REs go, "Ooh, there's something about acupuncture." And
Mhm.
so a lot of the reproductive endocrinologists were really quick to say, "You need to get acupuncture on the day of transfer,"
Mhm.
which is something we do provide. And we're really lucky and blessed. I have 5 acupuncturists on staff, so we're able to support that process pretty easily for our patients,
Mhm.
where we can actually show up on the day of embryo transfer and provide that treatment 25 minutes before and after embryo transfer. There's also options where you can come to the clinic if your acupuncturist isn't able to travel to you.
Mhm.
Certainly, you can do something like acupuncture like the night before, and then you can do acupuncture after embryo transfer the same day. So there's a lot of variations around it. I always
Mhm.
tell patients, like, please don't feel like you have to do the Paulus protocol. Like, there are other ways of, having success, but certain REs are like, no, 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 we really need them to come to
Yeah, they want to make sure their
acupuncture.
numbers are as good as
Ex
possible. Yeah.
exactly.
Yeah.
And of course, now that there's been more time since that study was released, and in the partnerships that we have and the fertility centers that we collaborate with, they are really good about referring patients earlier. So in an ideal situation, we don't really just want to see you on the day of transfer, which is
Mhm.
great. We'll be there for you if that's what you need. But we would love to see patients even before that,
Yeah.
to just prepare them and get them in a good place for their embryo transfer. And then, of course, after transfer, we focus on implantation support, usually after bed rest or house arrest. Depending on the RE, there's different protocols. Some doctors are leaning more towards like just 2 days of take it easy. Other doctors are still, a little bit more traditional where they'll say like 5 days total, 2 days of, bed rest and maybe like 3 days of house arrest.
Mhm.
So whenever the patient feels comfortable, they'll come back to our clinic for that implantation treatment. And once they're pregnant, we love treating them through the first trimester.
Mhm.
And I think more than anything else, besides just implantation support and pregnancy support, I think there's so much anxiety during that time and when you're hitting every milestone in that first trimester, especially if you're an IVF patient. So I think that acupuncture treatments do a really good job of quelling some of that anxiety during that time.
Definitely. Yeah, that's such a valuable piece of it of just,
Hmm.
I mean, for when someone's already been working with you and you are there, like you mentioned, the safe place, it's nurturing. That is very helpful to have like your people still there supporting you, but
Yes,
also to be able to have that nervous system calming and everything
absolutely.
with all
Yeah.
the
And
anxiety.
not to mention some of the other things that you experience in the first trimester, right? Like the nausea and
Hmm.
vomiting, unfortunately, the fatigue. We work a lot on digestion support in the first trimester. And, you're combating some of the side effects of your medications like progesterone, right? Which can be very constipating. So, and it can cause low energy too. So we're definitely treating a lot of different things in the first trimester. And I always joke with my patients that you can't get rid of us that quickly. We definitely treat patients throughout their entire pregnancy and into postpartum too.
Yeah, still so helpful, right? With the like the back pain that comes up,
Exactly.
all the
Yeah.
things preparing for delivery and all, yeah,
Hmm.
that's so
Hmm.
great.
And lactation support and postpartum
Hmm.
support too.
Yeah, yeah, awesome. Well, with this, what tips do you have that people can walk away with maybe today or this week, integrate into their lives and maybe start to improve their reproductive health, their fertility, or their well-being in general?
Yes, gosh, so many things. Okay. First, if you're trying naturally, I would definitely say get a baseline of your reproductive hormones. And I feel like some of the patients trying naturally, they're kind of afraid to do that, but I think that it's just data and it's so great for you to kind of know the status of your hormones. So I would definitely recommend that. And some of the supplements that I start patients on would be a really high quality prenatal vitamin with at least 1,000 micrograms of methylated folate, a fish oil with DHA, and CoQ10, at least 300 to 400 milligrams for sure. I think that's a good start for everybody.
Mhm.
And acupuncture, try acupuncture. If you haven't tried it already, it's really great for any kind of stress that you're having. And if for some reason your cycles aren't quite regular or you're not really sure when you're ovulating, acupuncture can really get your cycles into a really good rhythm. So you'll know when to try if you're
Yeah,
trying naturally.
important.
And then there's, of course, all the FAM, the fertility awareness methods that are out there that can be really helpful, like checking your cervical mucus. Besides checking your OPK tests,
Mhm.
definitely educating yourself on knowing, you know, when to time it based on your cervical mucus change is important too.
Mhm.
If you're a patient that is going through IVF or you're considering IVF, I would definitely say 100% get some acupuncture because it is so stressful when you're going through IVF. And I would say if you are unfortunately going through a couple of cycles and maybe you haven't had a successful cycle, I would say to get a second opinion. I feel like a lot of my patients coming in, acupuncture maybe isn't the first thing they started with. They probably incorporated acupuncture after a failed cycle. But sometimes I'm seeing things like you mentioned, Dr. Naylor, like doing the same thing over and over again. And when I see that pattern in their protocols, I'm just kind of like, well, you might want to get a second opinion because it doesn't seem like your RE wants to really change anything up or do any additional testing. And I think
Mhm.
it's really important to have that done. And if for some reason you had a chemical pregnancy or you're a patient that has had recurrent loss, I think a recurrent loss panel is really important to get done and to
Yeah,
advocate for yourself, to get those things done.
yeah,
So I think those would be my top things. And then for IVF, yeah, acupuncture is so supportive and, definitely your nutrients. Make sure you get those nutrients in too. And diet, nutrition, and stress reduction techniques. If you can
Mhm.
incorporate either yoga, meditations, or even daily affirmations, I think it's
Mhm.
a game changer for any patient going through fertility, any type of fertility. Yeah.
Yeah. Probably all of us, whether,
Yeah, actually, you're
I
right.
think about
All
it
women,
nowadays, oh my
all
gosh, I think
humans.
everyone, yeah,
Yes,
all humans
that's right.
should
That's
have
right.
something to combat the everyday stress that we all have.
Right, right. Whether it's first thing in the morning or before you go to bed, whatever is easier for you to incorporate.
Yeah, awesome. Well, that's so helpful. Where can people find you if they want to work with you or learn more about what you do?
Well, you can find us on our website, which is Revive Chi, it's spelled QI.com. And we do offer complimentary discovery calls. So that's a really good way to kind of get to know our practice a little bit better. And we're also on Instagram. So it's revive underscore chi, QI. So we try to post some educational tips on there and upcoming events. In fact, I do have a workshop that's coming up this Sunday. I'm not sure when this episode is going to be released, but it's coming up on April 27th. And it's a holistic workshop for fertility support. And so
Mm.
we'll be incorporating essential oil acupressure, Qigong for fertility. We will also have like an FAQ, a meditation and sound bath. And it's just a good time for women to find community and to really feel supported. So we try to do this every year around the National Infertility Awareness Week timeframe.
Mhm. Yeah, awesome. That sounds so amazing. Awesome. And you also have your own podcast, which
I sure
is
do.
helpful for women to hear, whether they're in California or Orange County or not. Um,
Yes, it's called the Women's Health and Fertility Podcast. And we interview amazing practitioners that support women through all phases of life. So, not only fertility experts, but also women that just or practitioners that treat, perinatal, prenatal, postpartum. So it's been really fun. I'm celebrating my anniversary, my 1 year anniversary actually in May. And I'm looking forward to having you, Dr. Naylor, as a
yeah.
guest very, very soon.
Yep.
So I'd love for people to check it out, and hopefully they can gain some knowledge and wisdom from some of our podcast episodes.
Yeah, definitely. Well, thank you so much, Dr. Yang, for being with me today and chatting with me. I think this was a really helpful conversation and will really, I think, shed light on, again, traditional Chinese medicine and acupuncture and, especially for the people who maybe didn't know about it or maybe feel hesitant to it. I think you've
Sure.
really explained it and really made it feel so much more approachable. So I really appreciate you for that.
Thank you. Well, it's been such a pleasure, and thank you so much for having me on your podcast, Dr.
Pleasure.
Naylor.